Priya, can I turn to you and ask you about the pandemic emergency facility? There's been a lot of talk about this as a new World Bank proposal. How is it going to work? How big is it going to be? What are going to be the trigger mechanisms? How is it going to be financed?
Thanks. So maybe just a little bit of context, as Chris and Catherine both mentioned, we're working very closely with a number of partners, with the WHO, with partners in the private sector and so on, to develop this mechanism. And you're going to hear a little more about this in later sessions. My colleague from Swiss Re, with whom we're working very closely on this, is going to be speaking in one of the subsequent panels. The mandate for this facility, so to speak, came from the G20 Brisbane Leaders Summit, which called upon the bank and the IMF to work on new flexible financing mechanisms to deal with future crises. And then more recently, we're very pleased to get the endorsement of the G7 at the Elmar Summit to move ahead with this pandemic emergency facility. It's still very much a work in progress. We haven't launched it yet, and we haven't started fundraising for it yet. But the idea really is that, after so when the G20 called upon us in November 2014 to develop a new mechanism, we started looking into what's out there and what's the need, and how can a new mechanism help. And the three sort of conclusions we came up with at the time were, one, and this has been spoken about in the earlier session today, is that countries need to get much better prepared to deal with crisis. Much more investment is needed, focusing on core public health systems and strengthening those systems so that when a crisis happens, the wherewithal is in place to deal with it, but also to sort of prevent a crisis from happening. The second sort of major area that we concluded was necessary was again something that was spoken about this morning, which is the need for a much smarter, better coordinated global epidemic preparedness and response system that draws on the expertise of all relevant players when a crisis happens. And then, of course, the third conclusion that we came up with was, yes, there is the need for a new financing mechanism. There are lots of mechanisms out there at the moment, but they're not necessarily geared to deploying money quickly to deal with health disasters. And so that was kind of when we started working on the PEF. The PEF stands for the Pandemic Emergency Finance Facility. And as I said, we're developing this jointly with the WHO, with a number of partners in the private sector, Swiss Re and Munich Re, and we're consulting widely. Now, how will the PEF function? So first of all, I want to emphasize that it's being designed as a flexible financing mechanism. We realize that there's a lot of thinking going on right now on the global pandemic financing architecture, and we want the PEF to fit in with what the new sort of global pandemic finance architecture looks like. So we don't want to kind of lock ourselves in a corner and have a mechanism that doesn't fit. In particular, we wanted to complement the WHO's contingency fund. And we're working very closely, and we'll ensure that there's complementarity. Second, sort of broad point I want to make is that I think one of the things that we learned from the Ebola crisis was that while we have mechanisms out there, the World Bank Group has a number of mechanisms. We have IDA, which is our fund for the poorest, which can deploy money for such crises. We have a crisis response window in the IDA. One of the constraints is that we can only give money to governments, for example, through IDA. We can't give money to WHO to kind of quickly deploy health workers, or we can't give money to MSF to be able to do what it has to do. So the way we're designing it is to ensure that it allows us to channel money to multiple players, whoever needs to get involved in the wake of a financial crisis. So this isn't a fund for the World Bank to implement. It's not a fund that will, where all the projects will be financed by the World Bank, but rather we see ourselves as a convener. We will host the fund, but we will collect money, but then we will pass it on in the wake of a crisis to whoever needs to spend it. All right. So how does it work? Well, it's not that complicated. The PEF will essentially purchase private sector insurance coverage for developing countries. to pay for the costs of crisis response. It's not a fund to cover losses, but rather it's to pay for immediate costs related with responding to a crisis. And the kinds of costs we're thinking of here, if you think of it in three buckets, one is the deployment of emergency health workers. The second is the provision of essential supplies, medicines, vaccines, medical equipment. And thirdly, the whole kind of communication and coordination bucket. It will deliver financing to, as I mentioned, to governments, but also to all other sort of relevant players that get involved, so WHO, UNICEF, WFP, MSF, international local NGOs, and so on, upon upon a parametric trigger being called. So that's really critical. Catherine mentioned the PHEIC. I think there is a view that in the case of Ebola, PHEIC was called sort of downstream. We're thinking here of a trigger that's kind of called much more upstream before sort of a crisis becomes a pandemic. Because the whole idea here is to prevent sort of a crisis from becoming a pandemic. So as soon as the trigger is invoked, then money can flow from the fund. The payouts will be financed by both the bond markets as well as reinsurance. So we're working both on the capital markets route and with reinsurance companies. And Nikhil, who's going to be talking about this later, will kind of explain Swiss Re's role in all of this. The premiums will be subsidized. The premium will be paid for by donors, and that's what we'll start sort of talking to donors over the fall. But we'll also leave the option open for recipients to pay premiums. So the idea is for the poorest countries, the premium will be subsidized. If middle-income countries want to participate, then they can contribute the premium themselves. I also want to mention that this model has been used for climate risks and natural disasters, and a number of my colleagues from the World Bank Group are here today, and they'll be talking about sort of how this was used in the context of climate and natural disasters, so I won't go into that, but it's not rocket science. It isn't something that hasn't been tried before, but it is new in the context of pandemics. Still kind of a few things I want to mention. This, as I said, is still work in progress. We are currently working on defining what the parametric trigger should look like, what's the right time to call it, what's the right premium amount, what are the diseases to be covered, and we're working with WHO on this very closely. We've kind of come to conclusions on most of these points, but we haven't kind of made any final decisions yet because we want to present options to our partners and to donors before we conclude on what the final design should look like. I should mention that the amount of the premium depends very much on diseases to be covered. It also depends on, is this going to cover diseases that happen once in 10 years, once in 20 years, once in 30 years, and depending on that, the premium will be defined. So I think, I don't know if that gives kind of an overview of what the path looks like.
That's enormously helpful. Clearly, the parametric trigger, as you describe it, is a really important design component, and we have a subsequent session that sort of picks up and discusses the notion of these triggers. But also, there's a delicate balance with these sorts of mechanisms between trying to create an incentive for people to improve their preparedness and lower the cost of the premium, but also creating barriers to deployment, which may also inadvertently create barriers to deployment of funds, because the more conditions you have, the more things get complicated. How are you, I appreciate this is work in progress, but how are you thinking about those trade-offs?
So, I think a critical thing here, as I mentioned earlier, finance is just part of the piece. So we don't want to create a financial mechanism that, just pushes, funds out the door to countries that are not prepared to absorb that money, right? So one of the things that we think that the PEF can really help with, one of its really kind of value addeds, is that we think we can use finance as a tool to motivate both countries and international players to kind of come together around crisis response plans. Plans that would articulate who gets involved, in the wake of a crisis and how the money should be deployed. So we're kind of not thinking of it in terms of conditionalities or carrots and sticks, but rather in terms of how can we use this financial mechanism to get all the players together around the table in advance so that when the crisis happens and the PEF is there, we know exactly who to disburse the money to for what. So that's the way I would kind of articulate it. And we're working, with both governments and international partners to sort of get these plans in place. We've done this for natural disasters. Our mechanisms are catastrophic risk insurance facilities. All have pre-agreed plans with countries that kind of define what the money is going to be spent for. And again, I mean, this is something that I'm sure WHO would like to chime in on. But that we believe is the critical piece. So it's more sort of motivating all of the relevant players to work together now, starting now, so that when the next global crisis happens, the PEF knows where to spend the money and how to spend it and who to give the money to.
Great.